Manual therapy involves skilled hands-on manipulations of joints, soft tissues, and nerves in order to relieve pain and improve mobility. The goal of manual therapy is to use specific hands-on techniques without the use of machines or devices. Here's a close look at how manual therapy is conducted by physio and manual therapist Mr. Roberts. This will help to understand the benefits of this type of treatment.
Now when you wiggle that pinky finger.
Have you ever heard that sound before? Sounds like it's someone's bone being cracked, right? But what if I tell you it's gas being released by someone's joints? This is done by physio and manual therapist Mr. Roberts. As you can see behind me, what he's conducting there.
So what it is essentially is it's using anything with your hands. So once I use my hands on you in order to produce or to relieve pain or to reduce any sort of discomfort that you have or to improve your range of motion or to improve your function with the use of my hands, basically that's what manual therapy is. And so we can use different modalities like massage, we can use cupping, we can use acupuncture, we can use scraping tools, we could use manual adjustments, cracking your neck, cracking your back, stretching, all these implements and all these modalities we can actually use to bring about some form of relief. Nice. And just relax there for me. Good. And so what we're doing right now is just one, we're doing two things. We're assessing your thoracic range of motion. Yeah. And then we're using this same assessment to actually introduce and soften introducing mobility, and we're actually using it as a little intervertebral stretch. A lot of normal, relatively healthy people walk around with a lot of pain in their necks, pain in shoulders, pain running down the shoulder blade, pain in the shoulder itself, pain in the mid back, the lower back, that kind of jazz. And then what happens is that you find people could have a lot of bulging discs, spondylolisthesis, spondylosis. Those who have them will know what they are, and rotator cuff injuries. Those are some of the main conditions that I see. And manual therapy really helps with those things, really helps with those conditions and puts them in a real good place and allows them to just recover real quickly. This side, huh? Good. So what we're gonna do, I'm gonna put you off that way. I want you to push your head to the right side for me. Push. Good. And this is a nice little stretch that we introduce in here. Get those muscles in them to relax. And then relax. Good. Go again, right side. And then relax. Good. The cracking or popping sound that you hear is actually gas escaping the joint. Yeah? And truth be told, it is not painful at all. It could be a bit uncomfortable, but it's really just gas escaping the joint. What we do basically is lock the joint in, and as we carry or give a little overpressure on the joint, gas escapes the joint, just like cracking your knuckles. It's very harmless. It doesn't hurt. It just sounds scary. And Hollywood has done this whole thing where they use that in whenever they're hurting someone, but really and truly it's very harmless.
The majority of people are eligible for manual therapy, but as with any procedure, there are people who do not meet the criteria.
Persons who have active cancers going on, persons who have rheumatoid arthritis, who have kidney failure, persons who have any autoimmune disease, people like that, or osteoporotic kind of patients, we tend to just stay away from those patients, because what happens is that when connective tissue becomes so soft and so brittle that if you do anything with them, they could break, they could pop, that kind of jazz, and we tend to stay away from that.
You can use different types of therapy techniques for managing trauma or pain, and exercise therapy is one of them.
There's a wide range of modalities that we can use, right? But cracking wouldn't necessarily be the only tool that we would use for them. Exercise therapy is where we use the patient's body themselves to produce that kind of benefit, that pain relief benefit that we're looking for. Sometimes when somebody may come in and they say, "Yeah, doc, I needed to crack here for me," But when you really look at them, they're stuck in one particular range of motion, meaning that they can't go into extension or they can't rotate evenly or easily. What we then do is take our time and actually introduce that range of motion with exercise. And as we introduce that range of motion with exercise, it brings down the pain in a very big way and allows them to live their life a lot better. The whole idea behind what we do as manual therapists is really to improve function and to improve your lifestyle and allow you to move and function a lot better and live the kind of life that you want to live.
With over 14 years of experience, Mr. Roberts is an expert in this field. Therapists who perform these types of therapies are qualified and trained.
When somebody actually does that, a professional does that on you, it's actually somebody who has been practicing for a number of years. I've been practicing for 14 years. And so when the adjustment should not be painful, it should not be uncomfortable. And if you have somebody doing something that's uncomfortable or something that's painful to you, then you need to probably just stay away or find someone else. The idea behind coming to see somebody like myself is to actually relieve pain and not to cause pain.